Everybody being here, I'll call the meeting to order. We'll move to item 2, the consent agenda. All of the following items, which concern reports and items of routine nature normally approved in AHA meetings, will be approved by one vote, unless any trustee desires to have a separate vote on any or all of the items. Consent agenda consists of discussion, consideration, and action on the following items. A, the minutes of the regular trustee meeting, August 27th, 2024. B, the Finance Committee minutes, September 24th, 2024. And C, the check report for August 9th, 2024 through September 8th, 2024.
Make a motion we approve the consent agenda, items A through C as printed.
Second.
Thank you. I have a motion by Dr. Brown, a second by Dr. Simon to approve the consent agenda. Any questions? Roll call.
Martin.
Here.
Bowman.
Yes.
Here. Simon. Yes. Mossberg. Yes. Brown.
Yes.
Hannaford.
Yes.
That's all right.
And we're glad you're here.
He's in class again.
Item 3, CEO's report.
Oh my goodness. Good stuff. Well, I'd be lying if I said that I was here for all of this. I was gone for most of it since the last meeting. And I just want to say thank you to all my staff for covering for me so that I could be gone. I'm grateful to have such a good group of people to be able to do that. And thank you to Kelly and to Regina for taking the brunt of it. And I truly appreciate it. Clinic visits were up 212, as you can see. Surgery still going well. Looks like they've had a full schedule and actually adding another clinic day in October to help with them taking some of that load off. Upfront collections looks good. It was actually up more than usual. Pleased to see our IT risk assessment still in the green, which is important. And for healthcare, as you can see, from time to time in the news, you'll see healthcare targeted by hackers, which is not good. And we try to keep our staff up on training, and it looks like they're doing a good job with that. Radiology staffing has been a bit of a challenge. We're looking for help, and even looking to sponsor maybe a student that is interested in a career in radiology. We're looking to partner with somebody that would want to do that, and if you know of a student that might be a good fit for that, that's interested, send them our way, because we're looking at partnering on sending somebody to Autry in Enid to get that training and come back to work for us. So throw that out there. Other than that, be pleased with how the revenue cycle is still coming along. I feel like that's headed in the right direction as long as we stay on top of it. It seems to be headed in the right direction, and hopefully our patients will be able to see that in the billing processes. So that's all I have. Does anybody have any questions for me?
Any questions?
Oh, one more. SLS, the behavioral health program, is slated to start taking patients the 3rd week of October, I believe.
Is there a cap on how many they take, or is that just a, okay,
10.
okay.
10. If we consistently hit that 10 mark, we can open another program and take an additional 10, but 10 is their max
Okay.
at any one time in that program. We would have to add additional staff to staff for another 10. So that's all I got.
Any questions for Candace? Not, do I have approval to accept the Share Medical Center written report for September 2024?
I move to approve the Share Medical Center written report for September 2024.
Second.
Thank you. Got a motion by Dr. Simon, a second by Mr. Bowman to approve and accept the Share Medical Center written report for September 2024. Roll call.
Bowman.
Yes.
Simon. Yes. Mossberg. Yes. Brown.
Yes.
Hannaford.
Yes.
Martin.
Yes.
Okay, CFO report.
Okay, August was a little bit rough. There were some good things though. I'll try to give you kind of a high level of everything. The cash balance for August was $214,000. It's about 7.8 days of operating expenses. The AR balance was $3,514,000. I'm sorry.
I could pass them over, but you got yours. So.
And that was an increase of $381,000. On the, as Candace mentioned, our revenue cycle, we have a lot of metrics that are improving, and our unbilled days are one of those things. We did have 52.6 days total unbilled, and our goal is actually right at 50, so we're getting closer to that. And so our improvement from July was 5.6 days. I'm hoping that we can maintain that or get better when we figure September's numbers. But that's going well. Accounts payable for August went down $309,000 versus July, down to $1,191,000. That's 87.5 days of expenses. The gross revenue for the hospital, again, that's another good thing. Typically, we don't anticipate that we're going to have $2.2 million gross revenue months in our summer months, but August was just over 2.2, and that was good. It was less than July, but like I said, it was nice to have that. For net revenue, we were down $390,000 versus the prior month, and that has mostly to do with our contractuals. And so our contractuals were up quite, not the contractuals as much as we had a bad debt write-off in July, which when we didn't have a bad debt write-off in August, that gave us a pretty significant change in the total adjustments. So the net revenue was, that's reflected in the net revenue. Compared to our budget, we had, if we divide the total budget for the year out evenly across 12 months, we are actually under budget by about $65,000 year to date. But if we compare ourselves to last year, we're about $227,000 improved compared to last year. We know that our revenue and our net income generally is better in the fall and winter months than it is in spring and summer. So, Cherry Care for August was $22,000. Operating expenses were $812,000. That was an increase. We had a few things happen in August that are either unusual or usual, but quarterly or annual payments that come through. So we did replace the roof. That was a typo in here. That was $130,575. The 340B expenses for August were up considerably, but also our 340B revenue was up considerably. And a lot of this was because of two different things. One was a program that we started, and it's called a credit replenishment program, and that allows holders to purchase their drugs from our vendor independently of our invoicing with the vendor. So holders can have a credit with them, they can purchase things that makes things run more smoothly. And then the other thing was that we did get some manufacturer restrictions lifted, and so several months, and actually probably over 12 months in some cases, there was a retroactive revenue and expense related to those manufacturer restrictions that were lifted. We did have a quarterly lease for surgery that was due, which wasn't an expense we had last month. And then we had increase in purchase services, and a good portion of that was due to a previous month that hadn't been booked in the previous month that we had to book last month. So overall, our net loss, net operating loss was $621,511. Our total net loss after non-operating income was $518,504. I kind of mentioned already how that compared to previous months and last year. If anybody has any questions on income statements, let me know.
Any questions for Kelly?
This may be done, but these accounts are written off to a collection agency. What happens to that money? I mean, the hospital earned it.
So
Everybody's trying to collect it.
So whenever we write something off to the collection agency, of course, that's after they've had 3 or 4 statements that says this is what you owe, after insurance is paid and all that. If they're not going to pay us, we send it to the collection agency. They have a multitude of ways that they go about trying to collect that, both from calling as well as small claims court or even more. So once it's collected, if it's collected, then we get a percentage of what's collected. We get the majority percentage of what's collected, and then the collection agency retains a percentage.
So when you say that's money we've sent to the collection, and we may get part of that back.
Mm-hmm.
That's okay.
We actually had a presentation in our finance committee today from North Star and asked a lot of the similar questions, so. Any other questions? Good. Kelly, anything else from our report on, or good to go for now?
Good to go for now.
All right. We'll move on to number 5, Medical Staff Executive Committee. Dr. Berg is not here. As you can see, we have some recommendations for credentialing committee. So we'll go to B. The following items from 5B, 1 through 6 are all initial appointments to the medical staff, and they will be approved or disapproved by one vote unless any members desire to have a separate vote on any or all of the following items. You can see all of these, 1 through 6, are courtesy staff. So Elizabeth Trow, LPC Behavioral Health, Amanda Matthews, LCSW Behavioral Health, Joe Krameyer, LPC Behavioral Health, Pamela Smith, LPC Behavioral Health, John Hooser, MD Hospitalist, and Landry Shipman, DO. Do I have a motion?
I make a motion that we appoint courtesy staff, those people listed in item B, 1 through 6.
Second.
Thank you. I have a motion by Dr. Brown, a second by Dr. Simon, to approve appointments to courtesy staff 5B1 through 5B6. Roll call.
Simon? Yes. Mossberg? Yes. Brown?
Yes.
Hannaford?
Yes.
Martin?
Yes.
Bowman?
Yes.
Okay, the next part will be the following items from 5B7 through 5B9 are all reappointments to the medical staff. They'll be approved or disapproved by one vote, unless any member desires to have a separate vote on any or all of the following items. So we have reappointments to courtesy staff for Ricky Reeves, MD Pathology, Sharita Wilson, MD Pathology, and Ruth Wanson, MD Pathology.
I'll make a motion to approve items 5B7 through 9 for reappointments to the medical staff.
Thank you, Mr. Bowman. Do I have a second?
Second.
Thank you. I have a motion by Mr. Bowman, a second by Dr. Simon to approve the reappointments to medical staff 5B7 through 5-9 for our courtesy staff. Ricky Reeves, MD, Sharita Wilson, MD, and Ruth Wanson, MD. Roll call?
Mossberg? Yes. Brown?
Yes.
Hannaford?
Yes.
Martin?
Yes.
Bowman?
Yes.
Simon? Yes.
Okay, thank you. 6, Quappy. Anything on Quappy you want
Just flipping through there, looking at their minutes, looks like we had 7 departments reporting, and all of them were well above 90% in completing their task, which is good. So sometimes that's a struggle with as many staff members as we have, but looks like they're all using SQSS as it should be. And I did talk to Regina earlier in the week, and she said that the company that we work with, Darling Bainbridge and SQSS, the Joint Commission is actually talking to her about looking into that system. So that's pretty exciting. We've been working with her for probably 10 years, working towards, where we've gotten today with it. And I think that says a lot if Joint Commission is looking to maybe partner with her or use her system. So it's helped us wrap our arms around quality for sure, but looks like they're staying on track and nothing out of the norm to report.
Okay, any questions for Candace on quality? We'll move on to item 7, improvement to patient care. Anything you want to highlight on A, contract review of quality evaluation?
No, looks like we have one, I don't know why
A
Fisher.
0, yeah.
Not sure why Fisher's not taken care of, but we can check
It
it
was
out.
reassigned and Coco's
Gotcha.
got the review done for September.
Okay.
So that'll be the next.
Yeah.
Then we do have B, discussion and action to approve or disapprove the revisions report dated August 31st, 2024.
Looks like there's a couple of pages of those, three pages of those, and final remarks, no changes made, or it will outline what changes were made. It's just, again, to help keep us up to date on reviewing our policies and procedures on an annual basis and making any updates that are needed so that when survey does come up, surveyors are looking at a policy that at least has been reviewed in the last year.
Any questions on the revisions report?
I move to approve the revision report dated August 31st, 2024.
Thank you. Mr. Bowman, was that you?
Yeah.
Okay. Have a motion by Dr. Simon, a second by Mr. Bowman, to approve the revisions report dated August 31st, 2024. Roll call?
Brown,
Yes.
Hannaford,
Yes.
Martin,
Yes.
Bowman,
Yes.
Simon,
Yes.
Mossberg.
Yes.
All right. Kelly, share convalescent home report.
So kind of big thing with convalescent home, I guess, is that bigger things. Census is hanging in there real well. They've had several people move in, and so they're maintaining a good census. When we talk about the finances, you'll continue to see that as people leave, share as an employer, our personnel expenses are going down on our expense statement, but you'll see that our contract services are going up, and so it's kind of all balancing out, and the transition is kind of just still moving that way. The sale, Adam is hopeful, anticipating, I don't know what you want to call it at this point, but that November 1st might be our date. And so if that's going to be the case, we should be hearing something before long, and definitely, or hopefully, by the time we meet next month, if that's going to be the case. Kind of a big event, kind of not something that we wanted, but the chiller kind of bit the dust for a little bit. I don't know if you saw anything on Facebook, but part of the electronic system on it failed, and there was no getting a part. It's still not repaired at this point, and so we had to bring in a temporary chiller on a rental basis. And so, I'll publicly thank Wayne and Eric Nielsen, Daryl and Scott Klein, Chris Green, and his help. But those guys all showed, and our staff, our maintenance staff, Jeff, Damon, Brian, and Gary helped out quite a bit. But that was about 28 hours worth of goings on with a really high level of activity for about 12 of that. So or no, take that back, about 16 hours, a pretty high level of activity. So they were able to get that hooked into the nursing home system without issue, so everything's going well over there, and I was glad they did because it kind of got a little hot there after a few days. But that's pretty much kind of what's going on over there. The finances, the nursing home did have a net income for August of $2,000, so basically break even. But from what we had been experiencing with losses, it's welcome. Year-to-date comparison, the net loss is probably about $2,000 as well. Last year, it was almost a $100,000 loss. So right now, rocking around pretty well break even, and hopefully, that can continue until we have the transaction finalized.
Okay, any questions for Kelly on Shericon Blessed Home? Okay, we'll move on to item 9, the homestead report.
For the homestead, they were honestly, they were about break even as well. It shows a $7,460 loss. We had some timing of invoices on the homestead where some of the September invoices were already entered in August. So that's primarily the reason that they showed that loss. But they would have been about break even without that. Year to date, they are right about the same as they are for the month of August. So it's a little bit less than what it was last year. But I will tell you, they've had quite a few new faces over there. A lot of new faces. They've had a lot of gentlemen move in as well. So it's the ratio is evening out a little bit, and it's going business-wise or operations-wise, it's going pretty well. Haven't had any major. Maybe I don't want to say.
No.
Everything's going well.
Good. Any questions for Kelly on homestead? Anything from foundation?
I do not have anything for the foundation.
Okay. No St. Anthony's reports. Mr. Bowman, City Council report.
Okay, thanks, Vandrest. The city approved the mayor or city manager signed contract to redo the taxiway lights at the airport. We extended the contract by 115 days on the pool because of the historical, getting the grants because of the historical on the bathhouse. And along with that, we approved adding a diving board to the pool. We approved the ODEQ permit for sewers and lagoons water lines at the Alva Rail Trust Park. Now this is the Lee Haley land that's out there. The good part is, and I've had many discussions, nobody's going to go out there because the plan is to set up lagoon sewer infrastructure for water, but then they're also going to, I think, 5 wells extra.
At the Alva well field, yeah.
Yeah, so we're going to gain 5 wells at no cost to the city. Now, whether a business is going to go in there or not, who knows. But we've got new infrastructure and 5 new wells for the city, so I thought it was a pretty cool deal. And the city and the tech center are swapping 3.97 acres. The lot would be on the north side. Basically, there's 2 lots there, and we're going to interchange with those. So Burns Field will have, am I saying that right? I think that's how it is.
It's going to be the track, and then for the other property is just, it's by the building on the south side. It's around the building on the south side of the tech center.
And that's about it.
Okay, thank you. Any questions for Greg? All right. not really a chairman's report, but a kind of a chairman's request. During our finance meeting, we wanted to see if we could move for the October meeting, move our finance meeting to October 22nd, and then push back our regular meeting to October 29th. So I was wondering if everybody could kind of check their schedules and see if that would be okay. We just don't think we'll have financials done in time to be able to do it as early as we had scheduled. Any issues with that? Okay, so I think we'll be able to make that change and send that out. New business. We had one thing that was discussed in finance meeting. We talked to our wonderful attorney and said that we could do this. So the enrollment period for insurance is coming up for the hospital. Had a request, which you have some papers in front of you, and I'll turn over to Kelly to kind of talk about the strategy of what we're doing here.
So when we met with Finance Committee today, one of the things we were wanting to see was if there would be an opportunity to increase what percentage that the medical center pays for employee health benefits. So that's their healthcare insurance premium. We looked at, gosh, I don't know, 20-some different scenarios of how this could all be, figured up and whatnot. And we were in between doing 100%, then we're talking about making changes to our frontline staff insurance benefit. So our managers and providers, their benefits are, we updated those July 1st. Now we're looking at being able to do an update to the frontline staff benefits effective January 1st with the new year's policy. So with that, question had become, okay, so if we can afford to do more, how much more do we want to do? And so we looked at 75% of the premium versus 100% of the premium. Clearly we want to do as much as we can, but exactly how much to amend the budget, I guess, is going to be a board decision. So if we do, what you have in front of you are basically two resolutions. One's for the hospital, one's for the homestead. And they are resolutions to amend each of the respective budgets. One of these resolutions for each one is at 100% of the employee health premium, and then the other is at 75% of the employee health premium.
And what do we currently pay?
We currently pay an amount that is probably, it's not simplified like this, but I would guess, Maddie, what are we in the neighborhood of about 30%?
It's a range from 30 to 47.
We asked them the same in finance, and it's really going to clean up and probably make it a little bit more equitable across the board for all employees.
So if we do a 75% increase, or a 75% employer paid premium, that would be an annual cost of $176,052.72, but for this fiscal year, the impact is half of that. So it's 80, I got it here.
That's
$70,861.
$70,861 for the hospital and $17,165 for the homestead. If we did 100% of the premium, then that's a $108,000 increase for the hospital and a $24,000 increase for the homestead. The question is, can we afford it? So we did budget for 2025 to have a surplus. So we budgeted more revenue than we budgeted expenses, and that was about $372,000. So can we afford it? Based on what we budgeted, we can afford it. But some other things to just keep in mind based on what we're currently experiencing, based on how we did the budget, because we were very conservative in how we did the budget. But with the 340B program, we are anticipating maybe not as great of an improvement as what we've experienced the first 2 months of this year, but we are anticipating finishing the year in a significantly better position than where we finished 2024. That could be as much as $250,000. You know, even if we finish the year, the next 10 months, flat with what we did last year, which I think is unrealistic. We'll be well above flat with last year. But even at that, we'll have about $102,000 more 340B just based on what we did the first 2 months. We also, when we did the fiscal year 2025 budget, we went flat with some of our purchase services, and that includes some of our Meditech Expanse implementation. So there's about $241,000 worth of expenses that we had in fiscal year 24 that we're not going to have in fiscal year 25. Now, we might have some other expenses this year that would kind of fall out of those categories that weren't in there before, but I would venture to say we're probably a good $50,000 to $100,000, maybe $150,000 of that would be available as a budget surplus if we didn't spend it on this. So I think, and then the other thing, we did get the 5.5% increase from Blue Cross and their reimbursement rates, and so that should equate to about $18,000 a month as well. So I think that it's not an unsafe financial decision to do either one of these options. And I think that we'll have some, things that maybe we'll be able to measure in the future in terms of employee retention. Maybe it's easier to recruit, job satisfaction, stuff like that. That every time we turn an employee over, the data out there shows it costs you about 1/3 of their salary just to turn them over, to recruit somebody new, train them how to do it, and all of that. So I think we'll definitely be better off to be able to do this. It's a struggle to recruit help, and I think this will help in that regard. And I think it'll be definitely be less of a burden on the people that we presently have, and maybe help them, enjoy their employment with Share a little better.
And you said that we look good right now financially to be able to cover this. Do you foresee that being in the future as well?
Well, I do. Number one being, I never would have expected to have a July and August where both months were over 2.2 gross revenue. That was completely out of nowhere. We didn't anticipate that at all. The 340B revenue, I really think that we're probably going to come in close to that $250,000 surplus over what we budgeted. Because we did get the downtown clinic finally fully established on that, and with manufacturer restrictions being lifted, I don't see that going the other way. And in fact, if we look at our 2024 performance, we were at a 75% profit. So far this year, with the backtracking or the retro pay and expenses that we've had, we're at 50%. But I anticipate that'll get back up to that 75% by the end of the year. That $250,000 is if we stay on track with a 50% margin. So I don't think it's going to get worse.
If nothing else, the Meditech, the implementation expenses that he just left in there, that covers a good.
Yeah, that's $241,000. That would cover darn near a full year's worth of 100% premium paid increase. So
we do have, just a caveat to that, we do have coming up that we're not there yet, Reese is working on it, that we do have to, for us to get off of old Meditech 6.0 and eClinicals, we do have to convert that data somehow, somewhere. So we've either got to take pictures of it and store it. Reese is working on that, but there will be some pretty hefty costs related to doing that that'll be a one-time charge. But then we'll be able to get rid of our monthly Meditech and how much is that? Our 6.0 maintenance and our e-clinical, do you know?
It's around 40.
That's our current one. I want to say it was around 11 grand or so a month.
So the e-clinicals is $8,000 a month, and I don't know what the 6.0 is.
Okay.
But I know the e-clinicals is $8,000 a month, so there's $96,000 a year
Right.
if we do that conversion.
How hard is it to do this again? Do we do this do we renew it every year?
We renew insurance every year. You don't have to do this again. This is here because it's not what we budgeted.
But he means that once we put it in place, it's put in place. We aren't gonna make a decision every
You
year.
don't.
Right?
But unless we.
If we go with the plan, it would be the 75%, which we kind of talked about. That was kind of we'd like to start finance committee.
Somewhere.
We kind of went back there, but if we start somewhere, at least we have some room to grow. And if we wanted to do something later on, we could do that.
You
Be
know,
hard to
until we
give it to
level
them.
everything out, you
And
know,
then take
Yeah.
it.
know what we have going on.
Yes, not buy
The
it all up.
employees' benefit doubled almost, isn't that right? So they're getting their benefit doubled, so.
It's gonna be a positive with either way we
It
go.
will be a positive with either, and I think either way we go, it's going to be good for the employees. It's going to help us out with the recruitment and retention. And, you know, I think, you know, Drew, you can weigh in here, but I think probably what you would want to do is when you decide what you want to approve, it'll be resolution 1 and resolution 2, but specify whether it's a 75% or 100%.
And you said the front, I don't know the exact verbiage, but frontline employees or whatever you called them, about how many employees is that this would impact?
That's going to be, if it's 75% enrollment, it's going to be about 41 employees, and 100% enrollment would be about 54 employees.
Okay.
We don't anticipate everybody will take it.
Sure.
So is that good with you in terms of, if we get a motion, we can just say?
Yeah. I think it'd be a motion to approve resolution 1 and resolution 2
For the budget amendment.
for the budget and that whatever percentage.
Okay, any other questions for Kelly or Candace? So do I have a motion on which budget resolution?
I'll make a motion to approve resolution 1 and resolution 2, paying 75% of the employee-only healthcare insurance premium.
Is that correct with resolution 1 and 2? Is it
If Drew says we can do it that way, that's correct.
up for the 75%? We can put it in that way. Okay, thank you. Mr. Bowman, do I have a second?
Second.
Okay, I have a motion by Mr. Bowman, a second by Dr. Brown, to make a budget amendment for our health insurance for resolution 1 and resolution 2 at funding at the 75% rate. Roll call?
Hannaford,
Yes.
Martin,
Yes.
Bowman,
Yes.
Simon,
Yes.
Foster,
Yes.
Brown.
Yes.
Thank you, guys.
Thank you.
And that will take effect in January, and then again, we'll look at
Next year.
next year for during the budget process. Okay,
Thank you.
any other new business? Hearing none, meeting is adjourned. Thank you, everybody.